You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Well, good morning, everyone. Another question and answer. So let's talk a little bit. I want to answer some of the questions here today. And by the way, all questions are good, okay? They're not, and maybe I won't pontificate for a long period of time on some of them. The reason is because sometimes they're not going to be very applicable to other people. So the ones that generally, if it's an individual thing, I might say a word or two and then I'll leave it. And I'd rather answer that specifically. Colleen is asking a question about collagen. Collagen, that's sort of a big thing now, collagen. And, your skin, your joints, your tendons, your ligaments, your cartilages, your eyeballs. Collagen is it's such an important thing, especially if you want to have nice skin and strong joints, and collagen is good for you. The best collagen is found in bone broth, because bone broth is like, you can make it yourself. It's a perfect food. It's got everything in it, all the vitamins, all the minerals, all the collagen, and everything that really your body needs. Your skin needs collagen. So do you take collagen on its own as a supplement? I guess you could. I like bone broth because it's like a complete food. It has everything that you need. So I'm more of a fan to get your collagen from bone broth, but I like collagen. Collagen, very, very good for you. Is it a waste of money? Well, look, I mean, if you make a bone broth and you take that, it's good for you. So no, I wouldn't say it's a waste of money. It's really good for you. Carol is asking about, she's had a hysterectomy, and ever since then she finds that she can't lose the extra 25 pounds that she put on. Isn't it fun being a woman? You know, if a man ever put on 25 pounds, it has nothing to do with the thyroid. It has nothing to do with hormones. It's because he's eating too much. But a woman, different. Body changes, especially in perimenopausal or menopausal years for some women. I remember a woman saying, "I'm praying for menopause. I'm praying." She was tired of her menses and that. I said, "You be careful what you pray for, because you never know just how things are going to be. Because if you're not in balance, a woman needs balance, okay? So let me put my two hands up. A woman needs estrogen and progesterone to be equal. If estrogen and progesterone are equal and they're balanced, your thyroid, which is at the top of the pyramid here, and your ovaries are here, your thyroid is here. If you have a decrease in estrogen and progesterone, you can go out of balance, and that can send you into symptoms like gaining weight and not feeling good and being tired all the time. And because what it does is that your ovaries keep your thyroid, ladies, balanced, okay? It's one of the most important things when it comes to your thyroid, never mind the imbalance in the adrenals. But, okay? So what I would say to Carol is, look, Carol, you need to get balanced. You're out of balance. If you gain that weight and you don't feel good, your thyroid is probably sluggish. Even if your thyroid numbers are coming back from your doctor in terms of they're within normal limits. Yeah, but being within normal limits, the ranges on the thyroid are from here to eternity, okay? So when they say normal, they're within a normal range. This is a huge range. So all I'm saying to you is that you can be down in this area here in terms of your thyroid hormones, and you don't feel well at all. You have to go by the symptoms, not necessarily just the blood test. And so you got to go, if you don't feel good, if you don't have any energy and you can't lose weight, yeah, it's a hormonal issue. And so one of the things that I would suggest is that for women, I love natural bioidentical creams, okay? Natural, not synthetic, not made from horse's urine, but made from plants, okay? And you don't, what I usually see in my practice is it's not that you have too much estrogen, it's you don't have a balance between estrogen and progesterone. And we can certainly help you with that. And so I suggest, call into the clinic and we'd be happy to get your hormones balanced, okay? Because that's a very, very important issue. And if you don't feel good, ladies, and you're in those menopausal years, well, menopause can be a wonderful thing because you can stop your menses, but it can be a terrible thing if you're out of balance, because you can get hot flashes, you can get weight gain, you can get night sweats, you can get depression, you can develop anxiety, you can develop... Hormones need to be balanced. Women, when you're not in balance, you will not feel good. And the key is your estrogen and progesterone, because think of your thyroid. It's just a little puppet. Your thyroid is a puppet. It doesn't act independently, ladies. It is very much hooked up to the rest of your hormones, especially if with estrogen and progesterone. And I've had ladies tell me, well, look, doc, I had a hysterectomy. It should be fine. Well, you had a hysterectomy, but you're still a woman. And your body has plan B. If even if you don't even have your ovaries, you're still going to secrete your estrogen and progesterone. But guess where they come from? Your adrenal glands. You're always going to be a woman. Always. And so there's a real fine line of balance that needs to occur. And if you're out of balance, you won't feel good. And this is why, it's good to know these things, because ladies, a lot of times, even that depression, well, ordinarily that means, it can be the thyroid, but it's not primarily the thyroid. It's probably coming from the adrenal glands, your stress glands. I'm guessing without testing it, okay? But I'm just giving you some information this morning because it's a very, very good question, okay? Judy's asking this: is it okay to drink coffee with honey instead of sugar? Well, honey is better than sugar, no doubt. Much more natural than just table sugar. But guys, don't fool yourself. We live in a world of where put your hand up and say, my name is Tony and I'm a carbaholic. We live in a carb world. We live where there's 200 pounds of sugar. The average North American is consuming between 150 and 200 pounds of sugar a year. We live in a different world. Sugars are added to all the foods. It's craziness. So all I'm saying is be very, very careful with honey. I wouldn't use a lot of it. I know it's much more natural than sugar, but if you're in that percentage of people that is consuming a fair amount of added sugars to foods, because they're add everything, because here's what happened. Here's the history of it. Dietitians and the food industry, 50 years ago said, fat makes you fat. And so they took the fat out of all foods and started adding sugar, to the point now, like I said, that the average North American is consuming, they don't even realize it because they're not reading their labels, they're consuming somewhere about 200 pounds of sugar a year. It's crazy. So that's why if you ask me, for the vast majority of my patients, I will tell them, no, I wouldn't even put honey in your coffee. Learn to, put some cream in your coffee to give it that sort of sweet taste. But try and get off all extra sugars if you can. We live in a different world, and that's what I recommend. So many good questions are coming in, okay? Can you overdose on B12? Well, look, there are 7 billion people on the planet and we all got our different fingerprints. It is very, very rare that you can overdose on B12. Why is that? You guys should know the answer to that. Why is B12, for example, different than vitamin E? Could you overdose on vitamin E? Not that I ever saw it in my 45 years, going on 46 years of practice. But because vitamin A, vitamin D, vitamin E, and vitamin K are fat-soluble vitamins. What does that mean? That means that those vitamins, you can overdose on them, okay? You can overdose on fat-soluble vitamins. But water-soluble vitamins like vitamin C and vitamin B, all the B vitamins, they're water-soluble. What's that mean? Well, the body takes what it needs and it pees out the rest of it, okay? And so it is a rare thing that you're ever going to get overdosed on B12, okay? And most people, what are they saying now today? That there's probably an 80% deficiency in B12 in the population in North America today. Why is that? Well, number one, B12 is a finicky vitamin. It's a very large structured vitamin, okay? I'm exaggerating, it ain't that big. But compared to vitamin C, okay, or other vitamins, vitamin B12 is a big vitamin. Your body, it's harder to absorb than other vitamins. So if you have any kind of digestive issue, any kind, acid reflux, or you got a poor digestive tract at all, you will not, most people will not absorb the B12 from their food. Secondly, so a lot of people, if you have any kind of digestive issue, B12 is a big vitamin. Secondly, most people avoid red meat because if you're a woman, you're eating chicken. When I ask my patients, ladies, what do you eat? What do you like? Chicken and salad. Chicken and salad. Salad and chicken. Chicken and salad. You need B12, and B12 is only found in red meat. There's not enough B12 in the plant kingdom or white meat, like chicken. For a mouse couldn't live on B12 in the plant kingdom, okay? So you need red meat. I'm sorry, but you need red meat. That is science, guys, okay? So a lot of women, especially because they like chicken, will be low in B12. So that's the second reason that people can be low for B12, okay? It's a finicky vitamin. It's a large structured vitamin. And a lot of people just never eat red meat. And if you have any kind of digestive issues, you're probably not absorbing B12. Well, then you need to take it as a supplement. The vast majority of my patients that come to see me, I have to put them on B12. Yeah, well, if you're not eating red meat and you're not taking B12 as a supplement, you are killing yourself slowly. You're destroying your brain. Your brain needs B12 to work properly. Your nerves need B12 to work properly. Okay? Your nervous system. B12 is your nervous system vitamin. It is an essential vitamin. And today we are chronically low in levels of B12. So now, can you overdose? Well, in 45 years, okay, of practice, I've probably seen it less than 5 times where people had to stop taking B12 because they got like either sores around their mouth or their tongue. They were getting sores on their tongue or whatever. But it's such a rare exception that it's hardly worth talking about because it's a water-soluble vitamin. It's not a fat-soluble vitamin. It does not accumulate in your body like vitamin A, for example. And I hate to even use vitamin D as an example because if you go sit in the sun for 20 minutes, you're going to get 10,000 IUs. And everybody, oh, I can't take 10,000 IUs of vitamin D. I might get sick. Nah, you won't get sick. Do you get sick sitting in the sun for 20 minutes? No sunscreen for 20 minutes. Okay? Don't get me started, okay? Because I get excited. Okay, so very good questions. Why do I crave carbs? Because you're a carboholic. You're a carboholic. Well, look, you can crave carbs for different reasons, okay? If your blood sugars are fluctuating, you will crave carbs. If you have leaky gut and you have lots of yeast in your body, you will crave carbs. Because yeast will call your name every day and say, feed me, feed me, feed me, and it really wants crappy carbs and sugars. So you probably have a condition, Eileen, of either low blood sugar, which would be because of insulin resistance. You know, high blood sugar and low blood sugar are two the same. They come from the same, it's insulin. So when you change your diet, you know, this is why I like a reset where you do a 4-week low carb, really no carbs. If you do that, you reset your body. It's unbelievable what happens, okay? And how much better you feel, okay? I've been taking Armour Thyroid for 12 years, okay? I'm very familiar with this. It's coming from, it's not the bovine one, it's coming from the pig's thyroid. I'm not against that if you feel good with that. Look, you know, I used to use Armour Thyroid a fair amount, but in the practice now, I like supporting the thyroid in a different way. Okay, but if Armour Thyroid is working for you, it's much more natural. It is much better than Synthroid, but you got to figure that out. And if you're feeling very good, stick with it. If not, I like our formula because we put everything in there that's specifically made to make your thyroid work better. It supports the thyroid, and it really is, and that's why I haven't used in my practice. I haven't used Armour Thyroid now for several years. Joanne is asking about excess phlegm in her throat. Could this be acid reflux? Well, it's one or two things. It's either acid reflux, and you're always doing that, and you might not feel it so much in your stomach, but phlegm, yes, that can come from acid reflux. It's sort of a silent acid reflux, but the other one can come from what we call a postnasal drip, where you have an overgrowth of yeast, Candida albicans within the sinuses. I see that all the time. Clean up your diet, get off the sugars, and that will get rid of both, because what happens is that if it's acid reflux, it's because your insulin's too high. You have insulin resistance and your body is screaming at you to cut the carbs out of your diet. And even if it's yeast in the sinuses and you're getting postnasal drip, when you cut your carbs down and your sugars down, you really do help not feed the yeast. I get patients taking probiotic and sniffing probiotic into here to get rid of the fungus, the candida, the infection in there. Okay? Not the infection, but the yeast buildup in there. Okay? Let me just do one more here. Okay? What can I do for a lack of stamina, zero motivation, depression? Well, Sylvie, this is definitely a hormonal thing. So, you know, you got to look at the thyroid. You got to look at where your estrogen and progesterone are. Clean up your diet. It's amazing when you go low carb how much this really helps. Okay, so look at all these things. You know, I'm suggesting, Sylvie, without testing you, that you're low in B12. I can almost assure you that you're low in B12. You're probably very low in vitamin D too. Okay, if you can get those tested, it would be good. Now, the blood test for B12 it's an old test. It's not that accurate, but oftentimes you're low in B12 and low in vitamin D, And even at your age, Sylvie, you might find that you're low in progesterone, because progesterone is an important hormone for women. So anyways, have a look at those things. If you're not sure, call into the clinic. We can help you even more. Okay, now we got lots of questions coming in here. Wow. I've only got to a few of them this morning. Clyde is asking, is it bad if you're taking too much magnesium and vitamin B12? Well, look, again, like I said, B12 is a water-soluble vitamin. If you take magnesium, the only side effect of taking too much magnesium is if you start getting diarrhea. So B12, again, the question was asked, is it possible to take too much B12? Well, it's very rare. It's a water-soluble vitamin. Your body will take what it needs of B12 and get rid of the rest. But I guess it's always possible. Everybody's different. We all have different fingerprints. That makes us different. So, you know what? If you take B12 and you have to take it sublingually, don't swallow B12. Because a lot of people tell me, oh, doc, I'm taking B12. Yeah, in what form? Is it sublingual? Well, if it's not sublingual, then you're not taking the proper B12. Okay, so guys, thanks so much for the questions. I'll come on here and try and answer more and more questions all the time. Send your questions in. Boy, we have lots of questions. Okay, and you guys are great. So talk to you soon.
You've reached the end of another Dr. is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.